Hi everyone, I'm Vikki Houlden. I'm a lecturer in the School of Geography at the University of Leeds, and I'm going to be taking a very literal take on the theme of greener cities and talk about how we can best leverage the health and well-being benefits that green spaces can offer, but particularly look at the barriers to access and inequalities within these relationships. So we know that green space can be good for us. I think it's really fortunate that over the last few years, the dialogue around the relationships between access to green space and health have really improved. And we have recommendations about spending 2 hours a week in nature can be really beneficial for our well-being. But this has changed a little bit throughout COVID. And I know I, for one, and I think many other people found that we've really relied on our local green spaces more than ever, particularly during the peak of the lockdown when we were allowed our one daily walk. And many of us were also fortunate to benefit from spending time outdoors in private outdoor space, so gardens, balconies, things like that. But COVID also exposed systematic vulnerabilities in both living environments and our health. So a study by the UK Friends of the Earth highlighted what we call green space deprivation, so areas with the poorest access to green space. Now, the standout finding really relates to Black, Asian and minority ethnic communities. So if you're a person of such origin, you're more than twice as likely as a white person to live in an area that's the highest levels of green space deprivation. That's after up to 40%. Now, this is compounded by the fact that green space can be particularly beneficial for certain socioeconomic and demographic groups. So people with lower socioeconomic status and people of Black, Asian and minority ethnic origin. They're more likely to have greater benefits from urban green space, especially in terms of stress and mental health, which have both been poorer throughout the pandemic. So if we look at how our mental health might have changed, looking at data from the Office of National Statistics, we can see that life satisfaction has really dropped between the period of March 2020 to March 21. While there are signs that this is starting to increase again, we can see that overall it does fluctuate and drops to the lowest levels in winter 2020. And this is kind of more pronounced when we look at inequalities and the different deprivations. So we can see that like depression, so an indicator of poor mental health, was much higher again towards 2021 than 2020, particularly for younger age groups, for women, for disabled communities, and people who might have more financial difficulties. And I'm going to talk a little bit about how my research has looked at this in terms of ethnic minorities as well. So my research comes into this by trying to examine kind of spatio-temporal patterns in both green space access and well-being throughout the pandemic. So we've got data from the Understanding Society survey, which had a specific COVID sample with about 4,000 people with complete data in terms of the life satisfaction variables I was looking at. But it also has really detailed demographic, socioeconomic and lifestyle data, as well as indicators on private outdoor space, so whether or not someone has access to a garden. Combine this with urban survey data, which has the amount or proportion of different types of green space within individuals' local area, so LSOA level, as well as combining this with the indices of multiple deprivation. Now, I started off looking at relationships kind of cross-sectionally, so kind of on a global scale throughout the data set before moving towards more spatial and temporal models. And I'm just going to talk you through some of my preliminary findings to start with. So when we look at life satisfaction over time, which is the key well-being measure in this data, we can see that overall, at population level, it does follow those graphs that we saw earlier from the Office of National Statistics. But when we divide this up according to whether someone has a garden or outdoor space, we can see that life satisfaction is overwhelmingly higher for people who did have such outside space. Like the graphs don't even cross over. When we control for a range of individual lifestyle factors, particularly economic, the gap does start to close, but we still see that well-being is overwhelmingly higher for people with access to private outdoor space. When we look at the same graph by region, we can see that kind of overall similar patterns again to the population level, but we do see particularly those green lines which are in the more traditionally more deprived communities, so in the furthest north, so northeast and northwest, have had kind of the lowest levels of well-being throughout the pandemic, but London also looking quite low there. Surprisingly, Yorkshire being really high up, overall better life satisfaction. Clearly, it's a good place to be. When we look at ethnicity, however, we see that these patterns kind of really start to come apart, and it really highlights how looking at kind of demographic and ethnicity kind of at a global level just doesn't actually characterize these individual experiences of different well-being patterns. So we can see that for white populations, so that's the blue and purple, white British and white other, they've kind of following the overall trajectory of dropping down and then fluctuating, starting to decrease towards the end. But we can see actually that particularly for Black communities, their well-being started off much lower and then kind of increased and decreased. But we can really see here that there's really different patterns that we just don't capture when we just look at a population as a whole without digging down into these socioeconomic demographic differences. So I started looking at associations between the proportion of different types of green space and life satisfaction. And this is where my analysis has got up to so far. But we can see that between the proportion of parks and green space, we see, and natural green space, we see these fairly strong relationship and significant relationships between the proportion of green space and life satisfaction, and this is adjusted for a whole range of socioeconomic, demographic, lifestyle and deprivation factors. So in terms of a kind of interim conclusion, COVID has really highlighted and exacerbated inequalities in environments, both access to public and private green space and subjective health and subsequent health outcomes. While the analysis is ongoing, it appears that green space may have been protective for mental wellbeing throughout the pandemic, and I'm really interested to see how these findings evolve and as I continue my analysis. Thanks very much.